Postnatal exercise guidance. So what research-based exercise guidance do we have for postnatal women returning to activities of daily life, exercise, sport, or even for those that are high-level athletes? Unfortunately, very little. In this presentation, I'll introduce a few recent papers that do exist. Some of the authors are pelvic floor physiotherapists, so they draw in a holistic perspective and consider the recovery of the pelvic floor when returning to exercise or sport. So just to give you context with the lack of research and guidance for this population in postnatal women, if we compare ACL rehab using ACC's numbers in New Zealand, 60,000 women give birth annually, and ACC predict around 28,000 birthing injuries. Now that compares to only 5,000 ACL ruptures. On a worldwide context, 140 million women give birth, 80% vaginally, and pelvic floor disorders are estimated to affect 19 to 25% of women. The injuries can have a major and pretty distressing effect on a woman's life and may even be life-altering with lifelong consequences on a woman's function, but the research out there is pretty poor. So one paper is a UK paper published only in 2019, and it's to provide guidance for medical health and fitness professionals in helping postnatal women return to running. So this table within the paper shows evidence-based example of exercise progression postnatally. The private PT will further present on this with examples of exercise. The idea of this timescale is that it's a guide rather than prescriptive. To briefly run through it, it starts off with the first 2 weeks with pelvic strengthening and some core exercises and walking. It further progresses to squats, lunges, bridging in the first month, then to low impact exercise or static cycling around 6 weeks. All this is individualised according to postnatal recovery, considering the mode of delivery, any perineal trauma, and any pain within the pelvic region. By 6 to 8 weeks, scar mobilisation starts alongside power walking and an increase in low impact exercise. Low limb and core low resistance can be started. Towards the 3-month mark, assuming any wounds have healed satisfactorily, swimming can start or even spinning class. So this paper recommends that postnatal women have at least 3 months recovery before they're even considered to return to running. Then they should undergo further screening, which I will talk to, and they should be involved in a goal-specific, graded return to running with consideration of any risk factors and modified according to any signs and symptoms. So the considerations to return to postnatal running once the mother is at least 3 months post-birth involves a subjective screening using a pelvic floor questionnaire and objective screening for 8 criteria that I'll go into more detail. And only once that is passed and they're approved to graded return to running, they might follow a protocol such as the Couch to 5K. If there are any problems, they will have to be referred to the relevant health professional to address any dysfunctional areas. So this guideline provides quite specific criteria to be screened and targets to be obtained. So looking at the pelvic floor screen, it's looking at strength of endurance of the pelvic floor, which is something we'd typically do, but it does guide to get to a certain baseline in standing. It also asks about incontinence and assessing the risk of developing any prolapses and treating accordingly in considering pessaries. So other than the static assessment of the pelvic floor, this criteria looks at the assessment of load and impact on the pelvic floor with dynamic tests involving balance, walking, jogging and hopping. And if the woman can complete these without any pain or any symptoms, such as the heaviness, dragging the pelvic region or incontinence. Specific strength testing of key muscle groups is recommended that she achieve 20 reps of these single leg exercises, including calf raise, bridge, sit to stand, and hip abduction. Other considerations before returning to running, including the assessment of a diastasis or DRAM, looking at scar mobility and healing, if she's still breastfeeding, BMI is greater than 30, also evaluating breathing pattern to ensure it's diaphragmatic, asking about adequate sleep, and assessing for psychological status. And finally, just checking that she has the appropriate clothing for sport for after her body changes, and if she is still breastfeeding, so ensuring she's got a well-fitting bra and the correct shoe size, for example. This paper also provides an initial running training program, just starting with 1 to 2 minutes of easy running at an easy pace, and then starting with shorter runs and building train volume, the distance and time before any intensity. And once she's at a decent distance, not increasing more than 10% train volume per week, and basically following a couch to 5K program, which includes walk breaks and builds gradually over 9 weeks, is a good place to start. Now we're just going to have a look at some other papers that provide some guidance to return to exercise for postnatal women. This 2021 paper uses something called a 6R framework that builds on return to sport models by using a proactive rather than reactive view for postnatal women in their journey to optimize their return to sport and achieve success and longevity. Starting at the top with Ready, which is from the prenatal to early post-birth period, involving being proactive about educating the woman about considerations from the transition from pregnancy to motherhood, encouraging maintenance of exercises, and how to optimize postnatal recovery. The second R is for review in the first 6 to 8 weeks, where the mother is evaluated for any kind of musculoskeletal or pelvic floor rehab needs. At weeks 6 to 8, R for Restore is about restoring the physical and psychological well-being of the mother and then returning to a structured training environment. From week 16 onwards, R for Reconditioning involves building up their physical and psychological sporting demands through graded exposure with individual and specific training loads and monitoring for symptoms as the training increases. The next stage is Return, as in return to sport, through an individualized and evidence-informed guided exposure to a competitive environment with regular reevaluation. The final stage is for refinement of the hold system and the biopsychosocial strategies, including things like sleep quality and considering Rett syndrome. And this is just to further enhance their athletic training and optimize their performance. In 2024, this review paper was published called Up for the Tackle, and it discusses pelvic floor disorders across the female lifespan and relevant biopsychosocial considerations in regard to the pelvic floor and rugby. The middle column discusses the major phases of pelvic floor across a female's lifespan, which I've touched upon across the presentations. So phase 1 relates to the predisposing factors of a pelvic floor and growth. Phase 2 is inciting factors, so that's in regard to pregnancy, the injury that occurs, and the recovery after a vaginal birth. And then phase 3, intervening factors, relates to changes with advancing age and any contribution of lifestyle factors that can impact the pelvic floor. The column on the right is really interesting as it outlines a rugby-specific pelvic floor training and progression protocol. The column on the left ranks exercise training and rugby activities that are from low to high risk of provoking pelvic floor symptoms. So at the bottom, at the lower risk end, they define upper body resistance training where tackling's at the higher risk. So the next 2 slides look at the specific training dosage and progressions for the pelvic floor, starting with a basic program incorporating the neck in various positions, and then using graded exposure to resistance and weights training in closed chain options and progressing to dynamic options. It then continues through graded exposure to the tackling training or the high-risk activity, pelvic floor disorders, throughout monitoring for symptoms and modifying or regressing as needed. The final steps are return to simulated match play before returning to sport. And then it does note for part of a wider training program to incorporate regular pelvic floor muscle trainings a couple times a week. The authors note in this paper that the recommendations are based on exercise prescription principles and research on the general population. This is because there is limited specific research for women rugby players. So these papers can be considered in the context of how to think about the woman's body and the pelvic floor within their lifespan and their return to exercise and sport postnatally. As I mentioned, the private PT is going to take you through some postnatal exercise progressions, but I'd just like to highlight some indications for signposting and onward referral for your clients. Hopefully your clients have seen a pelvic floor physiotherapist and had a warrant of fitness and been seen in pregnancy and postnatally. But if not, and they're still unsure how to locate and train the pelvic floor despite your information and cues, refer them on. Also, if they had no improvement in symptoms despite doing a regular pelvic floor muscle training, refer them on. Or if they have any symptoms getting worse or persistent pelvic pain, refer to medical or a pelvic floor physiotherapist. So just to recap, women experience significant physical and psychological changes during pregnancy, childbirth, and in the postnatal period. Don't assume because childbirth is a natural process that it only requires a natural recovery. Our women deserve better than that.